What might be the impact of steroid and lidocaine injection in the sacroiliac joint for patients with axial spondyloarthritis? This question has been the focus of a recent study led by Dr. Ahmed Elsaman and his team in Egypt, and the results are quite intriguing. The study aimed to assess the value of a combined steroid and lidocaine injection in the sacroiliac joint on both magnetic resonance imaging scores and clinical disease outcome measures for patients with axial spondyloarthritis. The approach taken by Dr. Elsaman and his team was both rigorous and meticulous. In their methodology, the participants were randomly divided into two groups. Group 1 received a unilateral ultrasound-guided sacroiliac joint injection with a 0.5% lidocaine hydrochloride mixed with triamcinolone. Meanwhile, Group 2 received a subcutaneous saline injection. All participants met the Assessment of Spondyloarthritis International Society, or ASAS, criteria for axial SPA and had bone marrow edema of at least one sacroiliac joint at the baseline. The outcomes measured were varied and comprehensive, including the visual analog scale for pain, ankylosing spondylitis disease activity score, spine mobility scales, Bath ankylosing spondylitis functional index, and Spondyloarthritis Research Consortium of Canada scores. These assessments were conducted at baseline, both before and after the sacroiliac joint injection, and then again after 3 months. In this study, a total of 61 participants were registered. The results revealed a significant difference between both groups regarding pain, spine mobility, and both SPARC and ASDAS scores, with Group 1 showing favorable results. Spine mobility showed the earliest improvement, followed by pain. The SPARC-CC and ASDAS scores showed improvement after 3 months. Interestingly, higher disease activity, younger age, and shorter disease duration were all associated with better outcomes. However, bilateral hip involvement was a predictor of poor response. In conclusion, the sacroiliac joint injection of lidocaine and triamcinolone in axial SPA patients proved to be a cost-effective and practical technique for controlling pain, improving function, disease activity scores, and bone marrow edema with acceptable complications and relatively sustained effect. These findings have significant implications for axial spondyloarthritis treatment. They suggest a viable, cost-effective method for managing this condition, opening up new possibilities for patient care and treatment strategies. This study offers a beacon of hope for those struggling with axial spondyloarthritis, demonstrating the potential of innovative treatments to improve quality of life and manage disease symptoms effectively.